My name's Samantha Spike. I'm the practice manager here at Ashville Surgery. I've worked at the practice for 25 years and I've been a practice manager here for the last 10 years. The most important thing about working in general practice is to ensure patient care is of a high quality.
How many patients are in this practice?
We're on 30,800 now.
Considering your role, what are the things that really excite you about it? What sort of, you really like doing?
Implementing change. I think in general practice, as the landscape's changed over the years, I think it's important to move with the times.
What are the initiatives that you've done that really you think this has really made a difference?
The Ask My GP, we'd already implemented this change 18 months before COVID had happened, and I think long gone are the days where I could turn up for work at 7:30 and we've got a queue of patients outside just for that 8 o'clock rush that they're where they wanted to, get an appointment on that day. That's not good healthcare, that's not good service or, good access. When we implemented this, there's none of the, right, get the phones, get ready to get on the phones at 8 o'clock. It's patients can have access, 24 hours a day, Monday to Friday.
Ask My GP is an app, isn't it, that people can get on their phones or computers?
Yes, it's an online request form where you can put a request in. It can be anything from a change of details, a medication request, or wanting to have access to a clinic. Patients don't queue up outside to get an appointment. The average waiting time is under 1 minute. So because we have around 76% of patients that use online, so they're using the Ask My GP, it frees up the phone lines for those patients who don't have access.
So if somebody rings up, and how long does it take them to get through and to make an appointment that way?
Okay, so what happens is a request will come through on the Ask My GP, or a patient will ring up and a receptionist will pop it onto the Ask My GP. What will happen then is one of the senior partners will review the request. So if it's something they feel that should be dealt with, and they will look at it. If it's to be seen today, we will get that in today. If it can be dealt with within a couple of days, i.e. a sick note, it's not usually urgent for the same day. And the turnaround for that is usually 4 to 5 days. So the longest somebody would wait would be 4 to 5 days.
For an appointment?
For an appointment.
And how many people work in this practice?
There's around 65 people that work. We do have different roles. We have GPs, training ACPs, we have nurses, nurse associates, there is healthcare assistants, reception, a vast reception and admin team, focused care worker, first contact physio, we have pharmacists, we have our fabulous practice health champions, and we're also a training practice, so we have medical students and specialist trainee doctors. I think my responsibilities, they spread right across. I wear so many different hats, from managing the finances, to overseeing the admin, the clinical staff, the wider support teams. Other than clinical work, I'll have a go at absolutely everything. I could have a screwdriver in one hand and a spreadsheet in the other.
Health champions, how does that work?
So with our practice health champions, they're a group of people, amazing people. They volunteer their time and do it very well. Yourself, Bernard, is one of them. And they offer different groups throughout the week, so they give their time up to help patients that will need more of time as opposed to a medical need and just coming in. So we have a lovely garden group who they can come and sit in the garden. That was a blank space. That was a dead space for many, many years. Staff use it to go and sit out for the dinners. So it's for well-being. We usually have a summer event and also a winter event, and in that we can look at different health promotions. So we've just recently done one around respiratory, which worked in quite well with Let's Talk Clean Air Day, which was quite important for Whalley Range. We have the older men's gym, which has been very successful. We have a walking group once a week. We've got the board game groups, and we have an older women's gym.
Yes, that's going successfully too. So you're quite innovative as a practice.
Yeah, we like to think outside the box because, and that's where it's important. I want to move away from patients just feeling that they need to see a GP. We've got some amazing clinicians, non-clinicians, where we can offer support, because it may not always be an health need, that we can support patients, because that's ultimately what we're here to do. It's a nice practice, and everyone's got the same goal, and it's about patient care. and that's what we want to deliver. And I think as a practice manager as well, if we're able to deal with patients efficiently, it helps with the staff. Staff feel rewarded and motivated that they're doing a good job, which will obviously help with the wellbeing as well.
Okay, thank you very much.
Thank you, Bernard.